Hi there, thank you for joining the ProMedica Pre-Op University online education class. In this class, we are going to discuss how to prepare for surgery, what to expect when you're at the hospitals, when you go home. We're also going to walk you right through the entire process from the time that surgery is scheduled to when you're actually at the hospital, looking at the different departments and what's going to happen in those departments. So in this class, again, we will just talk about how to prepare for surgery, what to expect when you're at the different hospitals and when you go home. If you were given a notebook in your surgeon's office, please bring that with you to any of your appointments, the day of surgery, and to your follow-up appointments as well. You will be getting some information, discharge instruction sheets that can go in here, and you can keep everything together all in one spot. The expectation is that all the patients go home the same day of surgery. There is a criteria that the patients do have to meet through nursing and physical therapy, but most of them do go home the same day. There are some appointments that your surgeon's office will schedule for you. They will be scheduling you your surgery date and time. They will also schedule you a pre-admission testing appointment. And they will also send additional information called EMMI. It's EMMI, and it's just additional information that they'll send if you have a valid email address on file. You may also need to get additional medical clearance from your family doctor, and also if you have any other specialty doctors like in cardiology or pulmonology. So I would call them before your surgery just to make sure that they do not need to see you in person to clear you for surgery. So at this pre-admission testing appointment, this appointment's normally 2 to 3 weeks prior to your upcoming surgery. It usually lasts about an hour to 2 hours. And at this appointment, you'll meet with a nurse. The nurse is going to ask you for a medication list. So we want to know everything that you are taking. We want to know if it is a prescription medicine, if it's over the counter, if it's a vitamin, a supplement, an herbal, anything like that. There are certain things that you might take that you have to be off of for a certain amount of time. So an example of this is we had someone come to this appointment. They did not tell us that they were on a diet pill. The day of surgery, the nurse is getting them ready for surgery. She's reviewing the medicines. And when the nurse was finished, the patient says, "Oh, by the way, I'm also on this one." The nurse looks and says, "Well, I didn't see it on your list." The patient says, "Well, it was just a diet pill. I didn't think you needed to know." So after talking to anesthesia, it was determined that this particular diet pill that they were on, they should have been off of it for 2 weeks. So the morning of surgery, they had to cancel their surgery. The patient wasn't happy. The surgeon wasn't happy. It's not our goal to cancel surgeries, so please make sure we know everything that you are taking. In addition, the nurse will tell you if there's anything to stop prior to surgery, as well as if there's anything to take the morning of surgery. So if you do have to take something the morning of surgery, you can take it with enough sips of water to get it down. So at this appointment, they're going to tell you when to stop eating, drinking, chewing gum. This is going to vary for everyone because your surgery times are different, so please just follow the instructions you're given. They are also going to tell you no drinking alcohol or smoking for 24 hours prior to surgery. When we talk about smoking, that does include cigarette smoking, cigar smoking, chewing tobacco, vaping, anything like that, do not do for 24 hours prior or the case could be canceled. And then at this appointment, they are going to give you your skin prep. They're going to give you the cleaning wipes. They will give you these with instructions on how to use them. These are to be done the night before, so you'll have instructions on how to use them. The night before, you'll take a shower, wait an hour, do the wipes, go to bed. You are not rinsing these wipes off after you wipe them. Let them just dry. Go to bed. When you wake up in the morning, you can brush your teeth, wash your face, put clean clothes on, and come to us. You are not jumping in the shower at home the morning of surgery, and you are not doing the wipes again at home the morning of surgery. Again, these are to be done the night before, so it has time to soak into the skin. So that you'll be told for the day of surgery not to wear any makeup or nail polish. Clear acrylics are okay, and clear fingernail polish and toenail and fingernail polish is fine, but no color. They're going to tell you no lotions or powders, no hairspray or hair gels, no perfume, body sprays, or colognes, and no deodorants. We also want to remind you not to shave any part of that surgical extremity for 3 days prior to surgery. They are also going to tell you to remove all your jewelry, so any rings, necklaces, bracelets, body piercings, anything like that do need to be removed. And you can brush your teeth in the morning, just do not swallow any of the water. So again, the expectation is that all patients go home the same day. Again, there is a criteria that you do have to meet through nursing and physical therapy, but most of them do go home the same day. We still want you to bring a few things with you to the hospital. So if you were given a notebook or a binder, bring that with you. We want all of you to have supportive rubber-soled shoes, so something with a back to it. If you have like your Croc shoes or the slipper type shoes, there's no back to those. And as you walk, your feet can actually slip out of them and you can fall. We want all of you to bring protective cases for any glasses, dentures, contacts, or hearing aids. For the knee patients, we want you to come in wearing loose-fitting clothing, so t-shirts, shorts, sweatpants, capris, something that you can do a light workout in. No skinny jeans or skinny type leg pants because we do need to be able to do some exercises with them on. So what not to bring to the hospital are going to be slippers. You're not going to need them. You can leave all your valuables at home, so like jewelry, checkbook, credit cards, you're not going to need them. We've had patients ask, hey, can I bring in my cell phone? Can I bring in my laptop? You can bring those with you. However, we recommend you leave your personal items at home. ProMedica is not responsible for your personal belongings while you are at the hospital for your hospital stay. At the end of this appointment, they will be printing you out an after-visit summary information packet. In this packet, they're going to highlight a few things for you that we already talked about. So they're going to highlight for you what time to be at your hospital, what entrance to go into. They're going to highlight for you when to stop eating, drinking, chewing gum. They're going to highlight for you the wipes, showing you how to use the wipes and where the night before surgery. And the last thing they're going to highlight for you is if there's any medicines for you to take the morning of surgery. Make sure you pay attention to this because it will list what to take or it will say none. If your information says none, do not take anything the morning of surgery because again, we'd hate for you to take something, find out you shouldn't have, and then they have to cancel the surgery. So now we're going to look at how to prepare at home. So we want you to go to the stores, get your routine home prescriptions filled. So if you go to Walmart, Rite Aid, Meijer, make sure you have enough on hand. We want you to get in any appointments. So any doctor's appointments, dentist appointments, eye appointments, even hair appointments. Anything you can do prior to surgery is going to make it easier for you. And then at home, we want to make sure that you have enough food or groceries on hand, laundry, banking, cleaning, stuff like that is done. Basically, we don't want you having surgery. You go home, the next day you run errands for 8 hours. There is such a thing as rest periods, and we don't want you overdoing it. So hopefully you have a good support system that can help get some of this stuff done prior to you coming in for surgery. So home preparations, we want you to clean your house, vacuum the carpets, the floors, rugs. A clean environment does help reduce bacteria and the risk for infection after surgery. It's important to remove anything that you could trip over. So look around your environment, remove any cords, rugs, shoes, anything like that. Additional lighting might be helpful. So sometimes patients may put a night light maybe between like the bedroom or the bathroom just to have the additional lighting. We want to make sure when you're at home that you have a phone with an easy reach. We also want to make sure that if you currently navigate around the house holding on to something and it's on wheels, stop using that. That could slip away from you. You could trip, you could fall. Knee patients go home with a walker. We want to make sure that this walker can get through your doorways, your aisleways, your furniture, whatever path you're taking in your home. If you have pets, just make sure they're secured when you're up and about. We don't want them running between your legs or causing any unstableness with you, making you trip and fall. And then we want you to arrange items within easy reach. So if there is some that you use daily and it sits up high or it sits down low, bring it to where it's within arm's reach. We don't want you trying to stand on a counter, a step stool, a ladder, or anything like that to try to reach something. So we want you to install a handrail near steps if able to. So whether that's going into the home or up to the second floor, it's just going to make it easier for you. At home, we want to make sure you have a comfortable chair or couch with arms and a firm cushion. We also want to make sure that you have 2 ice bags available at home. Here at the different hospitals, some of the surgeons will use just a regular ice bag. Some of them may use something called a Polar Pack. It's one of these devices that you put water and ice in, and then this will go, the water flows through the cord here, and this will sit on your extremity that you're having done. The surgeons will give you this at the hospital. And if you are going home and you are making your own ice bag, and I mean you're just putting ice in a Ziploc bag, that is fine, but make sure that you wrap it in a towel or a pillowcase or something like that so it's not sitting directly on the skin or on the incision. How long will you ice for? That is patient specific. We have some patients that do it for a couple of weeks and some that do it longer. It's just going to vary per person. We always want to make sure that you use the ice versus heat. And then items you might need for home. You can get these ahead of time. Insurances do not cover these. Would be a shower chair, your bath rails, your handheld shower nozzle, non-skid shower mats, and a toilet seat riser. Again, insurances do not cover these, so you can get them ahead of time and install them prior to surgery. The day of surgery, we want all of you to arrive at the hospital at least 2 hours prior to your surgical time. We ask that you leave your belongings in the car until we have a room for you, then your family members can go and get the stuff and bring it in. If you need your actual cane or walker to get into the building, you can bring that with you the day of surgery. The patient will check in at the front desk. They will get the patient back to the pre-op area. This is the first department that you'll go through the day of surgery. In this pre-op department, the nurses are going to get you checked in, get you into a gown. They're going to do nose-to-toes infection prevention, and all that is the wipes. They're doing the wipes with you that you did the night before and then cleaning inside your nose. They're going to get your vitals, so they'll get your blood pressure, your heart rate, your temperature. They're going to review your home medication list. They're going to start an IV. Once they have that completed, they will let your family members and friends come back and sit with you till you're ready to go back to surgery. Anesthesia will come and see you. They will talk to you about the different medicines available, either a general or a spinal. So the general is where they put you to sleep, they put that tube down. And a spinal is just that, it's a spinal, and then they give you medicine to help you relax, put you into a light sleep. How you will be determined will be up to anesthesia and your health history. You may also get medicine to help you relax, provide pain relief, relieve nausea. So many of you may take pain medicine daily. They may tell you not to take it the day of surgery. So now you're coming to us, you're painful, you're nervous, your stomach hurts, what do? Ask for something. There's no sense in going back to surgery feeling awful before it's begun. So if you need something, ask, they can give it to you. And then back in this department, the surgeon will mark the correct surgical site with you. So between the nurse that's working with you, yourself, and the surgeon, you will talk about which extremity you're having done. You will triple check it and you will mark it together. And that's before any of those medicines have been given to put you into that sleepy type state. Once you're ready to go back to surgery, family and friends will go out into the waiting area. When surgery is completed, the surgeon will come back, talk to the family members, tell them how things went, and answer any questions that you might have. Once the patient's ready to go back to surgery, anesthesia will start to administer the medicine. Your site will be cleaned again, so now that's the third time it's being washed. You did it the night before surgery. We did it again when you got here. Now I'm doing it a third time. We're reminding you not to shave any part of that surgical extremity for 3 days prior. So if any hair has to be removed, this is at the point that they'll do it. And then sometimes a Foley catheter may be inserted after anesthesia is given. So this is going to help drain the bladder. This will be removed when urine output is satisfactory. And again, that is only sometimes the surgeons may or may not use that. And then after the operation is over, a dressing is applied to your site. There are various types of dressings that can be used. Most common one would be a waterproof type dressing. This would stay on anywhere from 3 to 7 days or longer. The nurse will give you instructions on when and how to remove it and how to care for it after the operation. And then some of the surgeons may use just a regular wet to dry dressing. We will let you know what you have after your surgery. All right, so let's talk about your knee surgery. The picture that you're seeing on the screen is that of a normal looking knee. At the end of each of those bones, you see some white stuff. That white stuff is called cartilage. And with wear and tear, aging, injury, whatever the case is for you, over time, that starts to wear away. It wears away until you're rubbing bone on bone, and that's when you're in the hospital needing the surgery that we're about to have. So when we look at the knee, we're going to look at the knee procedure here. So this is your big bone or your femur or your thigh bone. You have your lower leg or the shin or the tibia. And what they're going to do is with your big bone or the femur, it's been rubbing on the lower leg like that. We're just going to come through and kind of shave that down, get it nice and smooth, drill 2 holes, and put your piece on. Now your lower leg, again, that's been rubbing with the top as well. So again, we're just going to shave that down, get it nice and smooth, drill down into the bone, and put your piece on. Now you need new cartilage. The body does not remake cartilage, so we have that for you. So we're going to put the cartilage on. And when it's all said and done, you will have the new knee. So for the knee patient, you have your kneecap or your patella that sits here in the front. It will be up to the surgeon and the condition of the kneecap if we're replacing it, resurfacing it, reshaping it up, but he will let you know what he did with the kneecap. A knee replacement, or it's called a prosthesis, so it's interchangeable wording. The incision is going to be about 4 to 6 inches on the front part of the knee. Again, the surgeon reshapes the femur, tibia, and patella so that the prosthesis fits correctly. The prosthesis has been measured prior to the surgery, so they know what size you need. So it's been either in that office visit or at that pre-admission testing appointment. The prosthesis is held in place with a special type of cement glue. It is a quick drying glue that they use. And the surgical time for the knee is usually about 1.5 hours to 2 hours. And the incision will be either stapled or glued. Your surgeon will determine how he's going to close that. If you do have the staples, those come out at your follow-up appointment anywhere from 7 to 14 days. And if you have the adhesive glue, that's going to dissolve over a couple-week period, and there's nothing that needs to be removed from that. So now you all had surgery. Now you're ready to go to the recovery room, or what's called PACU. So in this department, the nurses are going to get your vital signs, so your blood pressure, your heart rate, your temperature. They're going to monitor you for pain and nausea. Several methods will be used to increase circulation. This is going to help decrease the risk for a blood clot. So all the patients will have EPC cuffs on. This will be a cuff that will go on each of your lower legs. It's connected to a machine on the bed, and these will inflate individually. These are going to stay on you while you're at the hospital, while you're sitting in the bed or the chair. And then some of your surgeons may even order these for you to go home with. If they do, those arrangements are done through their office, but basically it's the same thing, except the ones you go home with are battery operated, so there's no cords or anything like that for you to trip over. In addition to having the EPC cuffs on, the staff is going to encourage you to move your lower legs. So any toe wigglings, ankle pumps, circles, anything you can do to keep the lower legs moving. You are in this recovery area anywhere from an hour to hour and a half. Once your vitals are stable, your pain is relatively under control, they take you to your inpatient room. Once you get to your hospital room, the nurse is going to come in, monitor your vital signs, so your blood pressure, your heart rate, your temperature. They're going to go over the doctor's orders with you. So they're going to let you know what you have ordered for pain, how often you can have it. They're going to talk to you about the discharge process. So they're going to review with you pain management, safety, why we don't want you getting up on your own, physical therapy, when are they going to come in and start working with you, and then just overall discharge plan. At all the hospitals, they have a policy program called Don't Fall. So we want you to call us anytime you have to get out of bed, go to the bathroom, go for a walk, anything like that. You have to remember that you just had surgery, so you have pain medicine on board, you're kind of unsteady, you have an IV running, so you have the IV pull. We don't want you tripping over the cords. You have the EPC cuffs on with the cords on each of the legs, so we don't want you tripping. So please call us. The staff will come in a timely fashion to get you up and get you up and moving, whatever you need to do. When they do get you up, they will get you up with a gait belt. This is a belt that they will wrap around you, and this just keeps the patient safe as well as the staff member. Once they go over all this information with you, you are then able to order your food. It's recommended that you start out with something light so your nurse can talk with you about the diet, but the staff will show you how to order your food and the time frame of which you can order and how late you can order your food for. We talk about pain management, so temporary muscle pain, excisional pain is expected. We've had patients that have had this surgery before that have said, I was told there'd be no pain, I'm in pain, what happened? Not sure who told them there'd be no pain, but again, everyone tolerates pain differently. So the goal is to make sure we have pain medicine for you and that it's working. So the nurse is going to review with you the pain medicine order. She's going to have you rate your pain on a scale of 0 to 10. There will be a pain scale on your communication board to go off of. The nurse will review with that and show you how to kind of decipher that. The only thing we ask is that when you rate your pain, be honest with the number that you give us. The reason we say be honest is the way that the pain medicine is ordered by your surgeon. Your surgeon may have something ordered that if you say your pain's between, say, a 1 and a 5, they're going to order this one for you. But maybe it's a little bit higher, it's between a 6 and a 10, so they're going to give you this medicine. We just want to make sure that if you are rating your pain, say, at an 8, that we're medicating you appropriately and effectively for an 8. Once they medicate you, they will check back with you in about 45 minutes to an hour. That is how long it takes to be effective. So when they come back, let them know, is it working, is it not? They can look at the other options that they have for you. The pain should decrease each day after surgery. Remembering to use the ice before and after for pain and swelling, that'll help. And then again, changing positions will also help with the pain. So the longer you sit, the stiffer you'll get. So at the hospital when you're here, please use your call light, call the staff member, we'll get you up and get you moving. In addition to having pain medicine on board, the nurse will review with you some non-pharmacological interventions. So these are interventions that you can use without having to take more pain medicine possibly. So these would be repositioning, getting up, moving around, music therapy, focused breathing. At home, it could be like a back rub, aromatherapy, other distraction activities, or just using the cold therapy or the ice that we talked about. Patients have had some success with these alternatives that they may not need as much pain medicine, but these will be offered to you as well. After any type of surgical procedure, you're at risk for a blood clot. So what can you do to help prevent blood clots? We're going to have you do lower leg exercises. These are going to be exercises that you'll do 10 times an hour while awake at the hospital, and while you're at home. So these would be lower leg exercises. So thigh tightening, ankle pumps, toe wiggling, ankle circles, anything you can do to keep the lower legs moving. You can do these exercises while you're sitting in the bed, the chair, the couch, recliner, pretty much anywhere. In addition to doing the lower leg exercises, there will be a medicine ordered for you to help prevent blood clots. The doctor will let you know what you're on and for how long. In addition, we want to make sure that you are not putting anything underneath the knee. So we want your leg to be nice and straight. We don't want any bends in the knee. So if you had something underneath your knee, the knee is slightly bent, the blood's not flowing like it should. So nothing underneath the knee. We also will have those white nylon support hose stockings for you. So on in the morning, off at night. And that is if your surgeon wants you to wear them. Some do and some don't. So the nurse will make sure that if they order them, you'll have them. And then again, the lower leg cuffs will be on while you're sitting in the bed or the chair. And this will help prevent against blood clots. After any type of surgical procedure, you're at risk for infection. So what can you do to prevent infection after surgery? Well, you already started doing it the night before with the wipes that you're using. We're using the wipes again when you get to the hospital, and then cleaning the skin a third time right before surgery. You will have antibiotics before and after surgery, and then making sure that you see your staff member come in, wash their hands, do whatever with you, and as they exit the room, they should be washing or cleaning their hands. Now, when we say wash or clean your hands, it is acceptable for them to use the soap and water that's in the room or the Purell dispenser that's on the wall. As long as your hands are not visibly soiled, either way will be correct. And then other things you can do to prevent infection when you go home is making sure that you wash your hands before and after touching your dressing or the actual incision. Keeping your bedding sheets, washing them at least once a week until the incision is completely healed. That will help prevent infection. And then if you have pets, we want to make sure that your pets are not licking the incision, licking the dressing, anything like that. So we kind of keep your pets at bay a little bit until that incision is completely healed so they're not doing anything, licking or touching it or anything like that. After any type of surgical procedure, you're at risk for pneumonia. So the nurse or respiratory therapist will come in, they'll assess your lungs. They will give you this incentive spirometer. They will show you how to use it. They're going to have you use this 10 times an hour while awake at the hospital. This is just going to help open up the lungs, in addition to coughing and deep breathing exercises, and then just getting up and moving around with a staff member. When you go home, you will have instructions from the nurse of how to use the incentive spirometer at home and what time frame, how often you should use it, and then what to do with this after you're done with it. So again, the expectation is that all patients go home the same day of surgery. Again, there is the criteria that you do have to meet through nursing and physical therapy. So we're going to look at physical therapy and what their role is during this process. So once you get to your room, therapy will come and sit with you and work with you. They're going to go over your home setup. So they want to know, what are you going home to? Do you have steps? If so, how many? Is there a handrail? Is it one rail, two rails, no rails? They want to know. If there is some issue or concern in your environment that you think is going to be a concern, bring it to their attention. So an example might be, maybe you have steep steps. We don't want to work with you on a normal height step if you do have something steeper. So take a picture of it, measure it, bring it to their attention. Another example is maybe you have narrow doorways and you're thinking, I don't even know if that walker can get through my kitchen doorway. Again, take a picture of something, measure it, bring it to their attention. Physical therapy is very knowledgeable and can help you if they know there might be a concern or an issue. So once they go over your home environment, they're going to help you get up, walk with a walker. And then if you were given one of the notebooks or binders, in that booklet there are a list of exercises for you to do. If you're able to do these a couple times a day before surgery, that would be great. If it hurts too much to do, don't bother doing them. They'll work with you on them after surgery. So while you're at the hospital, physical therapy is going to go over therapy exercises with you. They are going to look at doing getting in and out of a bed, so bed mobility, making sure you can transfer from a bed to the chair to getting into a car. They're going to look at stairs and overall balance, and then walking with the assisted device. So that's what we do with everyone, but we cater it to you. So if you tell us that you only have 2 steps to get into your home and none once you're in there, we're not going to have you practice 15 stairs. But if you say, I have 15 steps to get to my 2nd floor, we're not going to practice 2 steps and say, good luck with the 13. We're going to work with you to do what you have to do to go home to. So when you are discharged from the hospital, you will be able to stand and walk at least 50 to 75 feet. They figure this is a good household distance, can get you to the kitchen, to the front room, to the bedroom. You're able to go up and down stairs safely and get in and out of a vehicle with minimal assistance. So as far as a walker, if you do not have a walker right now, do not go out and purchase a walker. Without a script for one, you'll be paying about $100 for the walker, but while you're at the different hospitals, either a social worker or care navigator will get you a walker, usually for the cost of a copayment. The walker that you see on the video right now, the picture of it, is the type of walker that we want you to have. It has the 2 wheels on the front, nothing on the back. The one next to it has the 4 wheels, the seat, the handbrakes. We don't want you having that type of walker. Those are not safe for you after these types of surgeries. When you walk with a walker, you want to be inside of it at all times. Now, if you have the one with the seat, you're kind of already pushed outside of that walker. And as you move with that, if that was to start to get away from you, you're not going to be quick enough to think about putting the brakes on and you'll be on the ground. So let us get you something safe. There are walkers in all the rooms at all the different hospitals to use until one is available for you. If you do have a walker at home and it does have just the 2 wheels on the front, bring it with you the day of surgery because we want to make sure that it's a safe walker, it's the right size, it's in good shape. So bring that with you if you have the one just with the 2 wheels. So let's take a moment and listen to Jordan and Robin in the therapy services and see what they have to say about your surgery.
Hi, my name is Jordan. I'm one of the physical therapists here at ProMedica. After surgery is complete, your surgeon will order physical therapy. Physical therapy is going to consist of walking a safe household distance, navigating any stairs that you need to get in or out of the home, getting in and out of a vehicle, and performing exercises. If your surgeon provides you with exercises in a binder prior to surgery, we'd like you to start performing them if it's not too painful. So let's talk about using a walker after surgery. We recommend that you use a walker with 2 wheels in the front after surgery as opposed to a walker with 4 wheels if you do have one. If you have a walker with 2 wheels in the front, we'd like you to bring it in with you so that we can make sure it's the proper height and is in good working condition. If you do not have one, do not go out and buy one, as we can provide one to you here. Now, let's talk about how to properly use a walker. First, let's take a look at the height of the walker. Notice that the handles are at the patient's wrists when he is standing upright and his arms are down to his side. If you feel like your shoulders are too far up or you're leaning too far down, we can adjust the height of the walker for you. The proper technique when moving with a walker is to move the walker forward first, then step forward with your surgical leg, followed by your non-surgical leg. Now let's take a peek at what this technique looks like. The proper sequence for moving using a walker is to move the walker forward first, step forward with the surgical leg, and bring the non-surgical leg up and to the surgical leg. A safety tip when walking is to keep the knee as straight as possible, the surgical knee as straight as possible, when putting weight through it to prevent buckling and maintain safety. Your therapist will help decide which assistive device is best for you after surgery. Some patients have asked if they can use crutches, though typically immediately after surgery, crutches are not the best option as they do not provide as much support as the walker would. Similar to a 4-wheeled walker and crutches, a cane will not provide sufficient stability immediately after surgery, though you may progress to using one as you continue to heal. If you have any additional questions about which assistive device you should use after surgery, please feel free to ask your therapist and we can provide you additional information. Let's talk about your home setup for just a minute. If you do have a 2-story home and you are able to stay on the first floor when you leave the hospital, we recommend you do so. To navigate stairs, we recommend that you go up leading with your non-surgical leg and go down leading with your surgical leg. If you have multiple steps in a row but do not have a handrail, we recommend that you go backwards using a rolling walker and having a caregiver support the rolling walker. If you do have a handrail, we recommend holding the handrail on one side and a cane or a crutch on the opposite side. Now let's take a look to see what both of those techniques look like. Regardless of your specific home setup, the proper sequence for navigating stairs is to lead up with your non-surgical leg and lead down with your surgical leg. An easy way to remember this is up with the good, down with the bad. If you have multiple steps in a row and do not have any handrails, we recommend that you go up backwards and have a caregiver support the walker. To come back down, you will reverse the process and lead down with your surgical leg. If you do have a handrail available, we recommend you use the handrail on one side and a cane on the opposite side. To come back down, you are going to reverse the process and lead down with the cane, followed by the surgical leg, and the non-surgical leg. With regards to your vehicle, if you have the option, we would like you to bring a vehicle that you can comfortably sit in without having to stoop down to the ground or step up onto a running board for comfort and for safety. When you arrive for surgery in the morning, we recommend that you adjust the front passenger seat by scooting the seat as far back as it will go and reclining the backrest as flat as it will go. To get into your car, we recommend backing up and sitting just like you would into a chair. Anytime you go to sit down, we recommend walking your surgical leg forward so that your knee does not bend too much. When transitioning into the car, we recommend having a caregiver support the leg and then scooching up onto the seat back to allow for maximum leg clearance into the car. To transition back out of the car, we recommend scooching up on the seat back, having a caregiver support the leg, and turning out. When you go to sit down or stand up, a safety tip is to reach back and hold on to something solid, such as the dashboard and the seat back. Do not grab the door.
Hello, my name is Robin, and I'm an occupational therapist for ProMedica. Your surgeon may issue orders for occupational therapy following your surgery. If so, we will see you in your room to gather information about your home setup and environment and what your day-to-day activities looked like prior to surgery. You may or may not have some precautions that you have to follow, and if so, we will educate you on how to safely perform daily tasks like bathing, dressing, toileting, and simple home tasks following those precautions. Following surgery, we may recommend some additional equipment to help you be more independent with your day-to-day tasks, such as a reacher, a long-handled sponge, and a long shoehorn. The recommendation may also include items such as a toilet seat riser or toilet rails and a tub seat or tub bench. These items are typically not covered by insurance.
Thanks, Robin and Jordan. Now let's look at discharge information. So discharge information, if you are having surgery at Toledo, Bay Park, or Flower hospitals, they have a care navigator or social worker that will work with you the day of surgery to help you get a walker if you need one. Maybe you're interested in having like home therapy come to the home. They help with that. At Wildwood, because they are just orthopedic specific surgeries, they have a care navigator that reaches out to the patients usually about a week or two prior to surgery. She'll talk to you over the phone about your plans. If you need a walker, if you're interested in the home care, she helps make those arrangements. She will see you the day of surgery to finalize the plans. The preference is for other patients to go home after surgery. The doctors do order physical therapy for most of their patients. They usually order it anywhere from 2 to 3 times a week for 3 to 4 weeks. Where can you go for physical therapy? Anywhere that your insurance covers. If you were given a notebook or a binder, in that booklet, there is a list of ProMedica places available. Now, you do not have to just go to ProMedica. That's what's in the book. But if you've been somewhere before and they take your insurance and you like them, that's fine. You can go there. We give you a script to take with you. If you know you're going to be having like the home care come to the house for the first week or two, you do not need to make an outpatient therapy session until they're ready to discharge you from their services. We do like it if you do schedule a physical therapy appointment prior to coming in for surgery, just so you have the appointment made. So we don't want you having surgery. You go home, you call around, and now no one can see you for physical therapy for 2 or 3 weeks or more. That's too long to go without having physical therapy. So we'd like you to order, call and schedule your first appointment prior to surgery. When can you drive? No driving until your surgeon tells you to. None of you should be driving to your first post-op appointment by yourself. They kind of frown on that. But at that time, they can look at you, evaluate you, give their recommendations. It is going to vary from person to person because it depends on which leg it was, if you're still taking pain medicine, so just follow the recommendations by your surgeon. Let's hear from Tina with Care Navigation at ProMedica.
Hi, my name is Tina Seiler, and I am the Discharge Planner Care Navigator at Wildwood Orthopedic and Spine Hospital. I am one of many care navigators across the ProMedica system who are here to assist you with your discharge plan and making sure you have a safe transition to home after surgery. If you are a patient going to Toledo Hospital, Flower Hospital, or Bay Park Hospital for your orthopedic surgery, you will have a care navigator or social worker that will follow up with you after your procedure to make sure you have all of your discharge plans in place. They will also make sure you have the equipment you need, your appointments arranged, and a safe transition when you get released from the hospital. If you are coming to Wildwood Orthopedic and Spine Hospital, you will have a care navigator like myself who will call 1 to 2 weeks before surgery to discuss your discharge plans, equipment options, and rehab needs. One of the questions that we will be discussing with you on the phone is what your plans are for therapy after your surgery. Most patients and physicians do prefer outpatient therapy as it is more aggressive and will not leave you homebound. We also have the option of going home with home health care. Either way, whether you go to outpatient therapy or have home health care, you will have visits 2 to 3 times per week. When we speak to you on the phone prior to surgery, we are going to ask that if you plan to go to outpatient therapy, that you get your first appointment scheduled sooner than later. This is an initial therapy evaluation. It takes about an hour and a half. They do a head-to-toe assessment and review all of your exercises and things that you will be required to participate in at home. So this appointment takes a little bit longer. Any subsequent appointments are only about 45 minutes to an hour, and you're usually working with multiple patients. So those are a little bit easier to get. If you decide you want home care, you are required by your insurance to be homebound, which means church and doctor's appointments only. Home care usually lasts at least 2 weeks, and once you go to your follow-up appointment with your surgeon, that would be a good time to transition to the outpatient therapy. If your plan is to go to outpatient therapy, you do not have to have a script ahead of time. This will be part of your discharge package when you get released from the hospital and is expected to be taken to your first appointment with you. If we are setting you up with home health care, someone will be taking care of that upon your arrival to the hospital. We will offer you a list for choice, and we will make all the arrangements at that time. One other option that you have for discharge is going to a skilled nursing facility. This is essentially going to a nursing home. If you are a managed Medicare plan, please make sure that you have an alternative plan in place, as a lot of the managed Medicare plans are not approving skilled placement. When we do your pre-op phone call, we will also be discussing whether or not you were told that you would be a same-day discharge in the office. Many of you are probably aware by now, these are outpatient procedures and typically do not have an overnight stay. There are criteria that you will need to meet with both nursing and therapy before we release you. So please don't think that if it's not safe for you to go home, that we're going to send you anyway. We would keep you overnight and then plan for discharge the next morning between 10 a.m. and noon. If you are going to be discharged same day, you could plan for release from the hospital 6 to 7 hours from the start time of your surgery. In the event you are in need of a walker with 2 wheels before your surgery, your navigator or social worker that will be seeing you after will be happy to acquire one of these for you. If you have additional questions or concerns before your surgery, please do not hesitate to reach out to your care navigator or social worker or your physician's office. We look forward to seeing you, and I hope you have a great rest of your day.
Thanks, Tina. Now let's look at recovery at home. So recovery at home, you're going to want to use your walker to move about, continue the exercises you were taught, remember to use the ice after for pain and swelling, and then we want you to avoid prolonged sitting and standing. So you can sit like you do to eat dinner, watch TV for short periods of time. But after like an hour, stand up, stretch, go to the bathroom, go to the kitchen, come back and sit down, but now put your legs up. Put them up on a chair, couch, recliner, a footstool, just anything so that you're not sitting with your legs dangling for hours at a time. So again, recovery at home, they will give you instructions on when you can shower. Usually, most everyone can usually shower on day 2. Day 2 is considered, if your surgery is on a Monday, Wednesday would be day 2. Most of the patients usually have a waterproof type dressing on. That's the majority of them. So they will give you instructions on how to do the shower. That dressing usually stays on anywhere from 3 to 7 days or so. If you're in the shower, just let the water run down that dressing. When you get out of the shower, just take a clean towel and just pat dry the dressing. When you have instructions to remove the dressing, you're in the shower, just let the soap and water run down the incision. You do not have to scrub it anything. When you get out of the shower, again, just take a clean towel and pat dry the incision. When you are out of the shower, do not put anything on the incision. Do not put any lotions, ointments, powders, Neosporin, no peroxide. Leave the incision open to air. None of you should be sitting in a bathtub because that's too hard for us to get out of in general. And none of you should be sitting in a swimming pool or a hot tub until the incision is completely healed. And again, the nurse will give you specific instructions for showering dependent on what type of dressing you have per your surgeon. We want to remind you to keep your pets at bay and from underfoot. We also want to remind you to inform medical professionals now that you've had a replacement. So that would be other physicians, surgeons, dentists, anyone like that, because you will need to take antibiotics before any routine dental cleanings. So when you call the dentist office, they recommend waiting 12 weeks after surgery to do a dental cleaning. So when you call your dentist office, let them know you had the replacement. They will order you the antibiotics, or they may tell you to get it from the surgeon the first time. They'll order it thereafter. Just make sure that one of the doctors is getting you the antibiotic. Normally it is 4 pills that you take 1 hour prior to your cleaning. That's before each of the routine cleanings. Normally this is lifelong. However, after X amount of time, maybe your surgeon says, oh, you're good, you don't need it anymore. So just follow the recommendation from the surgeon. And then airport travel, you no longer need a card to go through security. They don't care. You can show them the scar. They're not going to care. They'll still have you go through the scanner, go off to the side. You'll make it go off. So the last part of this information class we're going to go over is warning signs. When should you call your doctor when you are at home? So we're going to go over these with you at discharge, but we're just kind of talking about it a little bit here. So we want you to call your surgeon immediately if you have any unusual drainage from the incision or the dressing. It's okay to have spots here or there, not a big deal. But if all of a sudden you did something, it's bright red, you have blood running down your legs, something like that, you need to call the surgeon. If you have excessive redness around the incision or the dressing, we want you to call. If you were to run a temperature greater than 101.5. Now, it doesn't mean you are going home and checking your temperature because you're going to worry yourself that way. Just if all of a sudden you're not feeling well, then check your temperature, see where you're at. If you have any calf pain or lower leg pain in the back of your leg, we want you to call. Or if you have an increase in pain from what you had while you're at the hospital or a sharp pain, we need you to call. So when is this going to happen? 2, 3 in the morning, probably a weekend, probably a holiday. What are you supposed to do? A lot of times the patients are so nice, they don't want to wake up the surgeon, so they jump in the car and they head to the ERs. Doctors hate that. They would rather you call them. It's either them on call, another physician in the practice, or a physician's assistant. Call them no matter what time it is, let them talk with you. It could be the middle of the night, you're talking with them. They may say, you know what, it's okay, go back to bed, come to the office tomorrow at 9, I'll see you. They may say, do you have a camera on your phone? Can you take a picture of something and send it to them? Or after talking with you, after looking at the picture, they may say, you know what, I think it needs to be looked at, and they'll tell you where to go. Again, we don't want you going into places, risk for infection, bugs, germs, unwanted copays, anything like that. So call them first, let them triage you over the phone first. On the flip side of what I just said, if you were to have any shortness of breath or chest pain at rest, we want you to call 911 immediately. And that would be after any type of surgical procedure, not just a knee, a hip, or a shoulder. It could be having a gallbladder surgery, an appendix surgery, having a heart surgery. If you are short of breath or chest pain, please call 911. Thank you for watching. This is the end of the class, and we wish you well with your new prosthesis.